Addressing a section of health stakeholders from various African countries at State House, Nairobi, President Uhuru Kenyatta noted that even though progress has been made in combating malaria in Africa, accelerated action is needed to eliminate the disease that causes 280,000 deaths in the continent.
93% of global cases, that's about 213 million, and 94% of the global deaths, about 380,000, are on our continent.
The head of state, who is also the incoming 7th chair of the African Leaders Malaria Alliance, a coalition of heads of state and government focused on eliminating malaria in Africa, announced 4 priorities during his 2-year term. He committed to engage regional economic blocs in addressing challenges and providing solutions in the fight against malaria, as well as facilitate access to real-time malaria-related data.
This will include the use of innovation and technology, to introduce sub-regional scorecards for review and action by heads of state and government, to share lessons learned and best practices. We also need to support African Union member states to enhance digitization and to use real-time malaria data at various levels.
President Kenyatta further pledged to increase resource mobilization by establishing at least 50 new End Malaria Councils and funds across countries in Africa.
End Malaria Councils and End Malaria Funds are very important country-owned mechanisms to enhance county-level prioritization.
The head of state further stated that he is dedicated to ensuring that all African countries join the Zero Malaria Starts With Me campaign, which has since been launched in 13 countries across Africa.
I urge all of us to heed our clarion call that zero malaria starts with me.
That campaign is specifically designed to promote individual responsibility to fight malaria, drive political will, domestic resources, and community action.
The campaign is launched in 12 countries, but our ambition is to make sure that it will cover the whole continent, starting with the most affected countries or the countries with high burden, malaria burden.
Earlier, during the official opening of the first Kenya Healthcare Convention in Nairobi, President Uhuru Kenyatta said that the government is working in consolidating Kenya's position as a regional healthcare hub.
And now, more than ever, I believe we must converge as stakeholders to see how we can improve the quality of our healthcare.
President Kenyatta said Kenya already attracts patients from several countries in the region, including Uganda, Rwanda, DR Congo, Tanzania, Ethiopia, South Sudan, and Nigeria. He directed Health Cabinet Secretary Mutahi Kagwe to ensure the rollout of the universal health coverage in other counties, following its success in 4 pilot counties.
In those 4 counties, we have seen increased access of essential medicines and medical services to excess of 3.2 million Kenyans. The national rollout of the program to the remaining 43 counties and by extension to every Kenyan is on course.
For Channel One News, I'm Safin Acheng Oma.